Thank you, Aaron. So I hope you had a great lunch. So is the food good? Okay. All right. So, most of the topic here is talking about the front end, right, with patients. So today, what I'm going to share is what the projects we have done, more towards the back end of what is happening back in the hospital. So just to have you have a glimpse of it. All right. So we incorporated. Sorry, they just let me get this right. All right. So basically what we do is that we have softwares for these 5 different hospital back-end services, which are mainly the facility management and maintenance, linen and laundry management, and clinical waste, and also the biomedical maintenance, right? We have software for them, and also the cleansing department. So today I'm going to just highlight more on the linen, what we did with using RFID technology, right, to do that. So how many of you have used a RFID tag before from Touch and Go? Right? So basically it's just a tag that's attached to your car windscreen. By right it should be inside, but you can put it outside also. And what happens is you go through a sensor, it sends. So what happened is that we use this RFID to be attached onto every single linen throughout the KKM hospitals. So we have actually tagged about almost 6 million RFID tags on these linens, and they are being used in over 60 hospitals right now. So what happened is we are giving an identity to each of the linen. So what happened is that the problem that basically is they are facing is as one checks into the hospital, the first thing they are looking at is once you touch the bed, the patient bed, what you are looking is the linen, whether how clean, how dirty. So this is a lot of complaints sometimes, right? So kind of we give the accountability to make sure the linens are clean so that the service providers can provide clean linens and on-time delivery for this linen. So using this technology, what we do is that we have hardware designed for them, RFID machines, and you can see over here is that they used to have to count how many linens are there, how much linen to provide for each ward. So instead of that, we can use our RFID handheld reader, and what they can do is they just Okay. So what they do is they just do a scanning on it, and immediately it tells you how many linens are already on the rack itself, without having to one by one count how many size S, how many size M, how many size L. So it's that convenient, right? So using this technology, we help the laundry providers and also the linen management team to know how much to allocate to each ward. Okay, so they will have to do weighing also at the same time before sending. Of course, we have also gantries whereby the RFID actually through a gantry can read almost 1,000 RFID linens, one shot, right? So actually our RFID in the Touch and Go is underutilized, so it actually can do it very fast. Okay, so one tag is about 1 second, less than 1 second. Okay, so for this, why do they need this? Basically, there was a lot of manual counting and a lot of paperwork to be done. So instead of doing that paper, now they take the handheld, go and scan them, and they know how much to replenish. So as they replenish, we know how many pieces are going to the ward. You know, there's always an argument between the service provider of the linen and the hospital saying that, hey, you didn't give me enough linens. I'm always arguing, you know, how much to pay you, what is the kilo, what is the weight. So with this, it kind of do all the kind of the billings, everything all can be satisfied, right? And no argument, because every person, every linen has an identity. Okay, so next is we can do, so since we know the data, we can do predictive ordering, so they know every few years what kind of linen to buy for what hospital, where, and what kind of ward is using more. And also, I believe there's a lot of doctors here. How many is guilty of taking some, doctor's coat back? I mean, if you're working, okay, so I believe there are some people who does that. But so just take note that it's being tracked at the same time. All right, so of course of the quality also, right? The linen has the washing quality, so they want to make sure that the quality, and also for vendor warranty management. Well, a linen is supposed to last for 3 years. It can be washed maybe about 100 times, right? And so what happened is that the linen and procurement department can easily tabulate this data. We can see, they can even see which laundry is performing better. And also during COVID, of course, there's linen contamination. we are identifying which were coming from COVID ward, which weren't coming from COVID ward, and how they can separate in terms of the washing. So actually this requirements was during COVID where we started implementation. All right. Next is we're also using the same technology. We went into clinical waste. Well, many of you might not know that the waste in the basket cannot be simply just disposed to any river or not like a normal dustbin, you can just throw it away. Well, it has to be tracked because all hospitals comply with the DOE to ensure that all their medical waste are being thrown into the right incinerator. So what we do is we work with companies like Agenta, Medivest, and Redicare to tag their bins and to tag where the waste going. So we have RFID tag, same concept, tag to the bin, tag to the plastic bags, and then they are being tracked as they're being sent out. How many waste is coming from what ward? What are these waste? And so we have the clinicals to do a DOE compliant. Okay, so we also kind of automate with fixing with the weighing machine so that they don't have we can eliminate their pen and paper. Okay, so basically it's the same thing, eliminating of need for manual processing, and of course to automate all their reports. And the most important is for DOE safekeeping, so that in case they are being query about where the waste going, how fast they can deal with the waste, they are able to do that. Of course, another thing is sufficient bin management, because if they don't have enough bins, they cannot discard their waste. So during COVID, I think there was a lot of waste piling up, because waste in terms of food waste, medical waste, all are being mixed up together for some in the wards. So this is also able to track how much waste they are being sent to the incinerator, how fast they can process this. Okay. So next also we went into real-time location service. I think just as another gentleman was saying, we are able to use tags to detect equipment, where are the people around about, where are they, the cleansing, the stuff. So we are able to kind of create, you can do a map like where they are. We can tell you exactly where's your staff going, to track, to know where are your staff doing and how efficient are we using them. Right, so we piloted this in the old folks home. I think just somebody was from the elder care, right? So we put tags on them. We give them a smartwatch, and we are able to detect where are they. So what we do is that we have geofencing around where they are supposed to go and not supposed to go during certain areas. So in case they fall, the tag has a sensor itself to detect whether they did a fall, and also whether during activity times, how many participants are there. And also we are able to track who are the health caregiver, so that in case, some, especially in the elder care, they are like complaining, who is taking care of my parents, we have sufficient evidence to tell what time they came in. Okay? So with the real-time location, we also use it in assets, so you can actually manage where are the assets, where the X-ray machines, the equipment in the hospital entirely, right? So you can identify the nearest resources. We can allocate the equipment, increase the hospital image of the resource availability, and of course loss and damage prevention by having proper accountability, monitoring of staff. Well, the patient and nurse, I think there's a lot of examples earlier, so I will skip that. All right, so that's all for my presentation. So thank you so much.